What's up, guys? This is Dr. Sebastian, and today we're going to be talking about discs in your back. So a common question that I get asked, especially by new patients, is, hey doc, I was diagnosed with degenerative disc disease. Exactly what is that and can you help? So before we get into degenerative disc disease, let me explain to you what discs are in your spine. So discs are cushions between bones, 24 bones in your entire spine. So these cushions, if we take a close look here, they look like jelly donuts. So they've got a fibrous outside, which is rings of collagen fiber, which makes the disc very tough. That's called the annulus fibrosus. And then you've got a jelly-like substance on the inside, which is called the nucleus pulposus. Now there's two major functions of these discs in the spine. So number one function is to be able to make you move back and forth, twist, okay? So all the movements in your spine are because these discs allow for that to happen, these cushions. The second function is to allow these nerves to be able to exit out of your spine, out of your spinal cord, without any pressure. So they form these holes here for the nerves to exit. That's very important because these nerves branch out and the brain controls everything, meaning your heart, your lungs, every organ, tissue in your body, fingers moving, everything. Your brain controls everything through these nerves. So it sends messages to different organs, tissues, glands. So we want to make sure that these nerves have no compression on them and these holes are nice and wide open. So now that we know what the function is of the disc, what the disc is, I want to get into what exactly is degenerative disc disease. So degenerative disc disease is the narrowing and wearing down of these discs in your spine. And that is caused by major causes, misalignments. So that can happen through a trauma like a fall, a car accident, or it can also happen through bad posture and even stress. So for example, let's say you take a fall and the joint, let me use this model here, the joint, in other words, the bone on top of the disc misaligns. And now this spine is misaligned. You may have pain and soreness, you may not even feel much pain afterwards and then it just goes away. But this joint is misaligned. Now, every time you're walking, running, it is moving incorrectly on top of the disc. So it may be stuck and it's only moving partially instead of moving back and forth. It's only moving partially like that. And what happens over time, and this is months and years, is that this disc starts to wear down. So in other words, we go from a very healthy disc, like we see here, nice and thick, to over years and years and years of wearing down, we go to a thinner disc. Now we've got about a decade or even a decade and a half of wearing and tearing. And here we're talking a few decades now. Now this is really worn down and you can see the bone degenerating as well, trying to fuse everything together because it's so worn down. So that's degenerative disc disease. Now, when you take a bad fall or even bad posture for long periods of time, what can happen to the disc is instead of the disc having that jelly-like substance right in the middle, because of the stress that you put on every day for hours, weeks, months in this bad posture position or that bad fall, what can happen is that the fibrous part, those fibrous rings that I was talking about, can start to rip and the disc can start to bulge towards the back. And with more time or a more serious type of accident, that can completely rip through all of those rings and actually spill out the back. This is called a herniated disc. Now there's different levels of herniated discs. I'm not going to get into that. That's on another video. But that can, cause, hey doc, I got shooting pain, fire down my arm, or I've got shooting pain, numbness down into my leg. So those types of symptoms are usually because the disc is pressing up on the nerve. There's a significant misalignment there. and that is causing the pain and the discomfort, and it can even affect different types of organ issues as well. So if you're enjoying this video so far, hit that like button, and I'm going to create a lot of awesome content in the future. So another common question my patients ask me is, can a degenerated disc heal? Short answer, no, but there are specific things that you can do to get that disc functioning better. So number one is change your posture. If you have bad posture, you're sitting a lot at work or standing in a hunched over position, that puts a lot of stress on those discs. Get into more an upright position. Change your station to be more in an upright position. That's going to take a lot of that stress off those degenerated discs. Number two is create motion. Go for a walk, stretch, do yoga, anything to create motion in that spine. That's what it was designed for. That's what those discs are designed for. They need motion, they need pumping. You need to create that motion for healthy discs. Number three, so important, is chiropractic care. The purpose of chiropractic care is to take a joint in the spine, in other words, a bone that sits on top of the disc that is misaligned and is putting stress on the nerves, putting stress on other tissues, creating pain, discomfort. And the purpose of chiropractic is to get that joint, that bone on top of that disc aligned properly for proper motion, proper nerve flow. And this is so essential when it comes to the degenerated discs and getting pain and discomfort out of there and creating better function and motion. Other things that you can do too is, for example, in our clinic, we do a specific technique called chiropractic biophysics, and we're certified in this specific technique to actually change people's posture. So in other words, people that have scoliosis or people that have forward head posture, to actually work structurally with the whole spine to change the ligament structure in order to change the posture for healthier discs, for healthier nervous system. Another thing that you could look into too is a decompression table. So chiropractors sometimes have these. In our office, we have a system called Back on Track, where it takes the spine and pulls it apart. And in some research, it has been shown that it can take some of this disc material and actually start to reabsorb it or suck it back into the disc. So it can really start to change in terms of, change your function in terms of pain and discomfort, radiating pain, numbness, those types of things as well. And the last thing I want to talk about is hydration. Make sure you're drinking enough water. When we're not hydrated properly, these discs start to shrink because the body uses that water for other vital organs. And when we have a disc that's dehydrated, that disc is very susceptible for further wearing and tearing, and that leads to other problems. So hopefully you've enjoyed this video. I hope you take this content that I was giving you pointers on and you start to actually put this into motion for yourself if you're dealing with these types of problems. If you know of any people that have degenerative disc disease and they need help, share this video with them. That'd be awesome. So next time we'll talk about another subject which is going to help with your health.